Wonderful. So obviously you guys are all here because you want to learn a little bit more about what pulmonary rehab looks like in a COVID world and maybe even send some of your patients our way, or maybe it's you that is experiencing some of these symptoms related to post-COVID, sort of the long haulers, what we're quoting the name of it now. So let's jump right on in. We're going to explore a few different things throughout this. We're going to talk a little bit about sort of what pulmonary rehab is and what it looked like pre-pandemic. And I don't necessarily want to use the word post-pandemics, but sort of what it looks like now. Some services and benefits. We'll take a little bit of a look into some global research studies. We'll take a quick look at what our program here at the Aultman Heart and Vascular Hospital looks like, and we'll note some outcomes and then sort of some follow-up steps afterward. So what is pulmonary rehab? And pulmonary rehab really is an exercise and education program with a goal of increasing awareness of lung disorders and thus increasing the management of those symptoms relating to it. So if we go into depth a little bit, what the typical service looks like is our COPD and emphysema, chronic bronchitis kind of all fall under the same umbrella. That typical service was for those patients, for pulmonary fibrosis patients, maybe those with asthma or other chronic diseases. And that's really what pulmonary rehab was prior to 2020. We are still seeing these patients, of course, but now we've expanded this coverage of pulmonary rehab services to include those who have known or suspected COVID-19. And that's kind of a key there is there's not a positive COVID test that is a requirement at this time for this, because I know it was difficult to receive COVID tests in the recent past, and that's not necessarily a qualification of standards. So you can either have known or suspected COVID-19 and have had respiratory symptoms or dysfunctions that have been persisting for the past 4 weeks at least to qualify for this service. And unlike traditional diagnoses, pulmonary function testing was not a requirement. So traditional services like COPD or bronchitis, those pulmonary function tests are necessary. However, with post-COVID, we see a lot of patients that have not had prior lung disorders anyway. So they probably don't have a pulmonary physician, and they probably don't have a history of needing any sort of pulmonary function testing. So that's something that is no longer required as far as pulmonary services if you are coming to us for a post-COVID diagnosis. Over the past 2 years, the medical and scientific communities have really come together, and we're trying to know as much as possible as we can about prevention, treatment, and the therapeutic strategies to help manage and treat COVID-19. The global research, as well as our own research, really support that, as you'll see some of our own research later on in this presentation. And we'll talk a little bit more about globally what we've kind of encountered with our research studies as well. But it's definitely proving that exercise programs are well-known modulators of clinical manifestations of this severe acute respiratory syndrome caused by COVID-19. There are exercise programs that these are paramount things, these exercise programs in reducing long haul symptoms. So what are some of the long haul symptoms that we kind of commonly talk about? These are here. So when you think of post-acute COVID-19 or sort of that sequelae of symptoms that accommodate or come from the original diagnosis of COVID, that might not even be the worst of it. The worst of it could be a few weeks after, where you're still struggling and dealing with these COVID infections. So chances are, if you've experienced a COVID-19 infection, you've probably checked a handful of these boxes on that left-hand side of the screen. So some of these could be things like respiratory symptoms like shortness of breath or chest pain or cough, very common ones, of course, or other symptoms like generalized weakness and fatigue. And that's what we really see over those preceding months after a patient has had a COVID-19 infection is they're so short of breath, they're very limited in their activity, and thus comes the fatigue and weakness. And we kind of get into this downward spiral of how do we get out of that. Other neurological things that could come along with a COVID-19 infection are, of course, things like headache, cognitive impairments, increased depression, sleep disturbances, loss of taste and smell, which is kind of a very uncommon one that we're seeing now too, and exploring some ways that we can treat that as well. But exercise attenuates these symptoms. They improve our oxygen uptake, thus decreasing our shortness of breath. They improve our pulmonary function and reduce the oxidative stress on our body. Exercise training improves muscular strength and stamina. Of course, we kind of know that at base value, but also improves our functional capacity and our immune response. So this immune response is really key when we're thinking of prevention for future infections or anything as we get into flu season. How can we better prepare ourselves for that even? So this exercise really helps to manage our immunity because we're decreasing an immune response. We're decreasing the inflammatory cytokines that are released whenever we have a COVID infection. And that sort of creates that cytokine storm, if you've heard of that phrase thrown around before. It increases that cytokine storm of inflammation responses across multi-systems of your body. And not only physically with our body, but psychologically, we have a big impact on our health too with exercise. It releases endorphins that modulate pain, promote release of serotonin, which is a mood stabilizer. We kind of think of those happy chemicals that make us feel good and help us reduce our stress levels. So overwhelming evidence really exists already that exercise produces these ranges of health benefits that prevent, delay, and mitigate even metabolic and pulmonary neurocognitive disorders, inflammatory responses, and musculoskeletal diseases. So we are just beginning to see these positive results as well as our world recovers from COVID. So what does that research look like initially? This is one of the earliest research studies that I was able to find. This research is still fairly new on the topic, and of course, it's evolving very rapidly. So the basis of most research remains the same. It's how can we manage and how can we reduce these symptoms that result from a severe acute infection of COVID-19. This early research study was completed in 2021. However, it was completed on patients during 2022, so very early on in the pandemic. These patients that are shown in this study were inpatients. They had an active COVID-19 infection. So therapists actually went into the hospital where they were, and they either participated in small individual one-on-one sessions, or they participated in a group setting. And these are some of the results that they are seeing. The table shows that physical performance results have really improved. So on the first slide or on the first section there, you can see balance before and after, and that has significantly improved. The structured results were pre and post throughout each of these. So before and after, you can see your balance score was improved. The functional capacity, which was measured by a 4-minute walk test, which is, of course, walking for 4 minutes. So our functional capacity is improving in how long and how far we're able to go within a 4-minute walking test. And then the 5 STS section you see there is improvements noted from a 5 STS test, which is sitting to standing. So from a sitting position, standing up 5 times back to back. What's your results from that? And all of these results are statistically significant. So what this initial research study tells us is that pulmonary rehab is possible, and it's very effective in patients that are recovering from COVID-19. These findings are really useful for us as we guide and care for our patients after a COVID-19 infection. So based around this research, as well as many others, and directed by our medical director, Dr. Knox, we've created a program very specific to providing care that promotes these sorts of results. So what does our program look like? This program at Aultman Heart and Vascular Hospital focuses on those goals of consistent attendance 2 times a week in rehab for a total of 18 visits, or roughly around 9 weeks, give or take. Classes are offered here at Aultman's main campus on Tuesdays and Thursdays at flexible times, and these sessions are completed in a group format, which is really the beauty of our program. Our patients come from all walks of life. When you walk through our door, what you experience and what you've experienced prior to walking through our door. That's really what sets people apart, because people walk through our door, whether they've had a COVID-19 infection, they're an athlete in school or in college, and these people just, they don't have the ability to complete the activities of their sport as well as they did before their infection, all the way to people that have been battling COVID for months. They've been ventilated for months and battling this infection, who have lost major motor functions, who come walking through our door the first day, or maybe even in wheelchairs with canes and on oxygen. Each of these people are searching for control of their illness and looking for improved quality of life. So no matter their differences, they all come together in this commonality of seeking improvement for their current status. They come up together in an hour and a half with us here, and we build from each other. We build on ourselves, lifting up each of us around us. And our goal is really to provide that environment where patients feel like they have that control over their condition back. That makes them a better self-advocate and increases their personal responsibility for their health. So that hopefully can keep people healthy and keep people out of the hospital. Really, these goals are done through a multifaceted program. So our program, when our patients walk through the door, when you or your patient walk through a door, what can you really expect? And these are some of the basic things. Each exercise session also comes along with education. So these exercise and education courses are provided by a multidisciplinary team of nurses and exercise physiologists who monitor baseline and exercise vital signs like oxygen saturation and blood pressure, heart rate. This group of clinical staff are really there to serve as a guide in your recovery. The exercise component specifically, we focus on cardio and resistance training, which is focused to improve endurance and physical strength, and balance exercises to address changes or challenges in equilibrium that a lot of patients report post COVID infection as well as cognitive activities that promote mental well-being and enhanced comprehension to cut through that sort of brain fog that we see commonly as well as a major long haul symptom. Then we also incorporate breathing exercises that are focused on building accessory breathing muscles, sort of similar to the resistance training where we're focused on more skeletal muscle. The breathing training focuses specifically on our diaphragm and training that muscle to assist us in breathing with a little bit more ease and less resistance, and helps rid our lungs of sort of the stale air and making sure we can take a really big deep breath in, thus improving our dyspnea. The educational side of things focus on more risk factor management. We talk about development of health literacy. So when you go to the doctor's office, you can comprehend what your doctor is talking about when he says, words like dyspnea or how short of breath are you. And we go over a little bit of basic physiology of the lungs. So knowing exactly when you take a deep breath in, what should be happening in your body and how can we affect that and improve it. We also talk about identification of red flags of their specific disease. So whether the patient has come through with a COVID infection or whether it be those more typical things like COPD, emphysema, asthma, those types of things. And how can we treat the symptoms that are associated with those disorders? Such as a really good example of this is with our post-COVID program, we have introduced smell therapy for people who have lost their smell. So that being incorporated can help manage some, of course, maybe not some of the more larger symptoms of I'm short of breath versus I can't smell, but that's a very impactful symptom for many people. So we do focus on big and some of those smaller things. We talk about nutrition recommendations and counseling on stress management techniques, really talking about the person as a whole. We know what our day looks like when you first come in our doors and what you can expect, but what can you expect as you go through our program? So throughout our program, we have certain checkpoints, and our initial assessment is a nursing assessment that includes a medical history, evaluation of recent lung complications, a physical assessment, The initial assessment also involves a 6-minute walk test, similar to the 4-minute walk test that we touched on in the earlier research slide. Our 6-minute walk test does focus on evaluating functional capacity of our patients on initial intake. So without any sort of exercise intervention, what is your capacity for exercise now? What are those symptoms associated? We also talk about goal setting that is focused on guidance for those risk factors management that we just talked about as well. The goal setting is led verbally by the patient, but then it's also led by questionnaires that they fill out on that initial evaluation. Things that cover nutritional habits or shortness of breath, activities of daily living. Also talk about the patient health questionnaire, or the PHQ-9 for short, that objectifies and assesses degree of depression severity. And the PHQ-9 survey is really important because depression is one of the most prevalent and treatable disorders that is highly correlated to post-COVID long haulers. So chronic ailments arising from a COVID infection, like fatigue, shortness of breath, headaches, those neurocognitive conditions, inability to focus on tasks, and then paired all of that with feeling socially and physically isolated, create this sort of perfect storm for developing depression. Therefore, it's really essential that we treat our patients not only physically, but also mentally as well. As we continue on throughout the program, after initial assessment is a 30-day assessment, and then an assessment every 30 days after that. We reevaluate our treatment plans, including, but certainly not limited to, nutrition, weight management, breathing training, medication use, psychosocial plan, their oxygen use, and exercise habits. And same thing for each 30, 60, 90-day reassessment. And then at our discharge, there is a final evaluation of the goals that I mentioned before, as well as a repeat of the functional capacity 6-minute walk test and those health questionnaires, including the PHQ-9. And these results collectively form the patient-specific outcomes. What are these patient-specific outcomes? Well, we've done a little bit of research on our base program and what we've been seeing initially since our program began at the beginning of the year. And what we are seeing is that among our cohort of patients that have completed the program, patients are reporting significant improvement in their shortness of breath and increased tolerance of their activities of daily living, leading to overall well-being. But then specifically and measurably, you see on the screen is we have a difference between functional capacity and that PHQ-9 I spoke about. The improved functional capacity that you see here, pre is sort of that light blue and post is the darker blue assessment in our functional capacity. Patients averaged 2.56 METs on initial intake, and METs is just a measurement of power. It's a metabolic equivalent, sort of like a wattage in your light bulb. So 2.56 is somewhere between, walking in the hallways at a leisurely pace. And then they've improved to 3.65 metabolic equivalents. And that would be almost equal to maybe being out in the fall in your yard and raking your leaves. And that might not seem like a big difference, but when we really break it down, patients are walking the 6-minute walk test at a whole mile an hour faster than what they did previously before they ever walked through our door. So that's a 42% improvement in our functional capacity that we're seeing with our patients in a very small group of people. So it's pretty impressive. We have also noted improved levels of depression by that PHQ-9 questionnaire. And again, the pre-assessment is the lighter blue and the post-assessment is the darker blue. Patients reported an average of 8.7 points on their initial assessment, which equates to mild levels of depression. And at the end, they've decreased to a minimal or a normal level of depression at 4.8 points on average. So that's a 45% decrease or improvement in their mental health, in their depression. These results are really exciting and they're invigorating. We plan to continue more of a focused study looking at the benefits of the post-COVID pulmonary rehab program here at Aultman. So I hope to be able to share some more of that with all of you in the future. Stay tuned for that. So what are the next steps? After you've gone through the program, you've received these wonderful outcomes, you're doing so much better. What happens now? So at program completion, ordering physicians will receive treatment plans and outcomes for follow-up at the next patient appointment. Now, Aultman practitioners with access to Cerner have access to these treatment plans and daily session reports all throughout the program. And we really, overall, the goal is to get our patients not only to that point of they're feeling better and they're feeling more controlled in their disorder or their disease, but they also continue receiving and seeking these improvements. So the goal is that they return to more of their normal life with reduced symptoms and lifestyle changes that keep them active and healthy. So in order to do that, it's highly encouraged that our patients continue their exercise program to maintain these health benefits and make additional progression towards their health. Here at the Aultman Heart and Vascular Hospital, we have the adult wellness program, which is a medically supervised program in an open gym format where our patients can come in and exercise and sort of know they're under a more watchful eye. And then, of course, we also have local health clubs and home exercise programs that can be suggested for these patients as well.